offered services if requested. To date, the minister responsible has intervened and is in discussions with the Mayor of Oka and Grand Chief Simon. These discussions are bearing fruit. If they need assistance, I will say that I am in constant contact with the minister, and they need only call. The Government of Canada remains prepared to act if anything is needed, but they are managing the situation. And as you know, obviously, as I said earlier, if you had followed the situation in February, there is constant communication with these communities in order to resolve these different issues. Follow-up question. Thank you very much, Mr. Miller. My question goes perhaps to Dr. Tam or Dr. New. You will decide. President of the Canadian Medical Association, Dr. Sandy Buckman, said that the country is not prepared for a second wave and is concerned about the lifting of the current measures. There's a lack of medical staff. What do you think of this? What do we need to do? And do you agree? Thank you for the question. This is Dr. New. I cannot comment on the opinion of another individual, but I can tell you this. Dr. Tam and I continue to work closely with our counterparts in the provinces and territories and with all levels of government. Everyone understands that there may be a second wave, perhaps in the fall. We are working very hard to ensure that we have the supplies of equipment required and the human resources to do the contract tracing and enough vaccines for the seasonal flu. This is a current issue. We are continuing to work and prepare and plan. We want to be prepared for a second wave that perhaps might occur in a few months.
Thank you, Dr. Operator. Next question, please.
Thank you. Merci. Our next question, notre prochaine question nous vient de Jamie Pashagomskam with APTN. Please go ahead. À vous la parole.
Hi, thank you, Mr. Mill. Sorry. I'm wondering about the $75 million for urban indigenous that you announced today. How will that money be divvied up? And specifically, will the CAP get its $16 million that it was asking for?
It's Jamie, right? Thanks for the question, Jamie. That $75 million will be divided up according to the submissions that we have received. As I had mentioned in a previous update, the $15 million that we had allocated was well oversubscribed, and so it is a question of allocating the remaining amounts, or even increasing current amounts that have been funded to organizations that are working on the front line to provide services to Indigenous peoples living in urban settings, increased amounts. And that's a decision that'll be taken within Indigenous Services Canada and rolled out in the most expedient fashion. I can't comment on the allocation as to any particular group that solicits funds. Obviously, we strive within the department to allocate these funds in an equitable fashion to serve those who need it most, in the most expedient fashion.
Jamie, follow up?
Yeah, thanks. You mentioned that obviously you've heard from CAP, but what assurances do you have that this is now going to be enough? Have you heard from other urban Indigenous organizations?
Well, it's hard really to comment on the sufficiency of funds that we allocate. We obviously looked at the profile of the amounts that were asked through a very open process that Indigenous Services Canada ran, and a very open submission process in a very short period of time, and noting that it was well oversubscribed. Obviously, it was an expression of need, but as I can't trace the outcome of the pandemic curve or as to whether second or third waves will hit and where and how, it is difficult to say that will be sufficient. Certainly, this funding is one of the largest envelopes for the urban Indigenous space, noting that they are service providers that haven't been particularly well funded in the past. So it is a very significant amount, and whether it is sufficient or not isn't for me to decide. We'll have to constantly, and as the Prime Minister says, constantly reevaluate as we trace the course of the pandemic.
Thank you, Minister. Opérateur, prochaine question, s'il vous
Thank
plaît.
you.
Thank you. Merci. Our next question, prochaine question, nous vient de Michel Lamarche avec TVA. Please go ahead. À vous la parole.
Bonjour,
Question. This question is for Minister Duclos. With regard to airlines, why is it that we cannot say today to consumers that they will be refunded and that financial assistance requires refunds to consumers who purchase tickets? Thank you. There's 3 parts to the answer I will give. First, we fully understand the frustration of consumers in Quebec and across the country, people who bought tickets, made reservations, and paid, and now who are having trouble getting a refund. We also understand the very difficult situation in which airlines find themselves. We know that the short-term prospects for these airlines are quite modest and even of concern. Third, airlines should do everything they should and need to do to deal respectfully with their clients. If these companies want to reopen once the crisis has passed, they will need customers. And the way that they treat their customers now is essential. At the same time, to respond more directly to your question, I would say this. We are offering liquidity terms to companies, including airlines, in order to ensure they can keep their customers now, but also have some for later.
So we understand. I'll answer very briefly in English. So we understand fully the frustration that consumers in Canada have when it comes to getting their air tickets being reimbursed. This is a significant source of frustration for them, given that they have reserved and paid for their tickets. We also understand the difficult situation in which air companies everywhere on Earth, and in Canada in particular, are going through now and will be going through in the next while. So we know this is a crisis that is going to affect them for a little time. And third, we believe that they are best able and certainly expected to understand that if they want to have consumers in the future, they need to be treating them with respect. So given all of this, we also are offering these companies and many other companies ways to increase their liquidities and pay them emergency wages so that they can go through the crisis and work with their customers in the appropriate manner.
Michel, en suivi?
bien sûr, pourquoi?
Supplementary question. Why, when we listen to the lack of an answer, that you're favoring the airlines rather than consumers? And I'd like to ask about seniors. Will they get the assistance you announced last week? Answer. We understand that it's a difficult situation for everybody. It's an emergency that has a negative impact on many, many people, but also on companies. And we expect these companies, as I said a few moments ago, to treat fairly and respectfully their customers. With regard to assistance for seniors, we are working quickly. The minister said so last week that we hope that the major investments that will be made as quickly as possible, as well as ensuring that they are made properly, so there is no errors made in the payment of these funding.
Starting with Julie Van Duzen from CBC.
Julie Van Dusen, CBC. Dr. Tam, considering all the complaints about testing, that not enough testing is being done across the country, can one assume that Canadians aren't getting the full story then on how many people are infected? In other words, the numbers you reveal every day, can one assume they're much higher?
I think throughout this epidemic, we know that the numbers will be higher than the people who actually got tested. So during the height of this epidemic, there would have been people who stayed at home or had mild illness who would not have been tested. So at this phase, the strategy increasing testing in the community setting for people with even mild symptoms. Now, it's quite possible, and I know that I've heard from chief medical officers that, in fact, people are not necessarily showing up to get tested. Maybe they're not having symptoms, but there's also then needs to be more sort of systematic some set up to test different people in the community, particularly in high-risk settings. So I think that's part of the, obviously the strategy going forwards. All I can say is that, I think there is good collaboration with provinces and territories. Every level, as you've seen at the sort of very highest levels of government, people are seized with the need to increase laboratory capacity and testing. So I think as I think I mentioned yesterday, the key is to be able to jump on any increase in cases and do contact tracing really, really fast. So I think the other thing I would say is that that's why we have the immunity task force and the serologic testing, because we know that in this sort of there is a sort of bit of the iceberg underneath that we don't know about in terms of the true prevalence of the infection and who had previously been infected. So the serologic surveys or studies will help us sort of further understand what is the sort of proportion or percentage of the population that may be affected. And that has to be done across different areas of the country, in different age groups and in different settings as well.
Thanks. Now, I'm just wondering when you think the second wave is coming, and are you concerned it's going to be helped along by the fact that we've got everything happening now, the nice weather, things opening up, and people, a lot of Canadians talking about getting in their cars this summer and driving around?
So we've been messaging the importance to adhere to the core public health measures, because I think obviously this is quite a difficult period. I think it's one of the most difficult periods of the time where people have been observing these public health advice, and now some things are easing up, and there's sort of exuberance of maybe getting out there means that people may forget to do all the core public health measures. So it is very important that we keep reiterating these messages. And as I said, I might sound like a broken record, but I will be doing this all the time, because right now is not the time to forget those core public health measures, like the physical distancing, washing your hands, covering your cough, etc., and wearing a non-medical mask if you can't keep the 2-meter distance in a community where the virus may still be circulating. I think what will happen is that if essentially clamp down on any sparks, the immunity in the population, we don't know the true immunity yet, or the true sort of infection rate, if you like, but it's not going to be that high. So there'll still be susceptible people. And if they reignite another chain of transmission, we have to jump on it really fast. This virus can accelerate really quickly. And so we've seen it accelerating really fast in that first wave. So we have to be really cautious, because it might not take much for another chain of transmission and an escalation to occur. Be it small waves that we clamp down, we really need to suppress those so that, again, it doesn't overwhelm the health system. Dr. New talked about, planning ahead for different scenarios, and one of them is planning ahead for the next fall-winter season, because usually respiratory viruses, we don't know enough about this coronavirus, but many respiratory viruses increase in the fall-winter time, including influenza itself. So some of the planning does include making sure we have enough influenza vaccine, making sure that continuously we increase our capacity. We're still acquiring ventilators, still building up our PPE capacity, the testing capacity. All of those things has to continue to increase so that we will be prepared for different scenarios, including even a bigger second wave.
Thank you, Doctor. Mr. McGregor.
Glenn McGregor, CTV News. Question for Dr. Tam, just following up on Julie's question. Some Canadians are considering flying this summer as well. I don't know if you've seen some of the pictures from inside airplanes recently, but there is pretty much a breakdown of physical distancing, especially when people are getting off the plane. Passengers sit one row after each other, not anywhere close to being 2 meters apart. I'm just wondering, do you think, considering airlines are federally regulated, that there needs to be tougher and more enforcement of standards on travel, air travel right now?
So that's a really good question because right now, what's in place, of course, is screening before someone gets on a plane to Canada. At the federal level, Transport Canada has instituted mandatory wearing of non-medical masks on planes and other federally regulated transportation. But because it is fundamentally almost impossible on a plane and sort of the corridors, etc. There's more, I think, being done by the associations for the airlines and also to look at, well, there's also other measures inside the plane that you might be able to do in terms of how do people get to the washroom? How do you, do proper environmental cleaning? How do you protect both the staff and the travelers and the environmental cleaning aspects? Also, of course, we will be continuing the border measures in terms of making sure people go then into mandatory quarantine. Other countries have lots of measures. So any traveler flying somewhere else need to be very cognizant of what those are. You might actually have to be isolated for 14 days somewhere else. So be prepared for all of those things. But I think that this is actually a very active piece of discussion in that sector. As in all businesses, Chief Medical is advising people to have a plan and let us see what that is. So I think that sector is trying to pull together all the different elements of the layers of protection that it needs to, in order for traveler confidence, I think, to be built up. But from a public health perspective, we are pretty extremely vigilant about this because the virus has traveled to every country in the world. There's different activities still in different countries. We don't want that importation to occur. So it's both for traveler protection going out there and for people sort of coming back in. You would expect that level of vigilance and screening and isolation to continue. But of course, I will say that we'll have to keep evaluating these things on an ongoing basis. And I know that I'm not sure if Minister Duclos or others will talk about this, but obviously interdepartmentally, there's lots of conversations about how to safely look at air travel, or actually other forms of travel as well.
Thank you. Follow-up for Minister Duclos. You mentioned the difficulties the airlines are having. One of those challenges is that airlines are federally regulated under the Canada Labour Code, which can be more onerous in some cases, especially dealing with termination of employees. Have you given any consideration, your government given any consideration to relaxing or waiving any of the provisions of the code so that airlines can respond more agilely to the crisis they're facing right now?
Well, that question is not only important, but of course would be best placed to my colleague, Minister Tassi. What I can say, however, is that our top priority is the health and safety of workers. We do feel and do understand that many companies, including air companies, go through difficult times. But protecting the health and safety of their workers is absolutely essential. So while we believe that there are extra costs to doing this, we also are offering all sorts of different support to make sure that not only is this the government's priority, but also the priority of businesses.
Thank you, Minister. Mike?
Hello, Mr. Duclos. So municipalities are talking about cuts from everything to arenas and pools to essential services like fire and police. Will the federal government, either on its own or in collaboration with the provinces, provide the $10 to $15 billion that is being requested by the FCN?
Very good. Well, Minister Frieden just yesterday and Prime Minister Trudeau a couple of times in the last few days as well have repeatedly said that we are fully mindful of the difficulties that cities and municipalities go through in Canada. And we are therefore hearing them. We are ready to help them. However, this has to be absolutely in collaboration, and with the full support of provinces and territories. So this discussion is ongoing, and we look forward to continue it.
Thank you, Minister. We're now going to turn back to the phone. Operator.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Hélène Buzetier avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour.
Question. My question is for Minister Miller. I'd like to come back to the question asked by my colleague. It concerns the checkpoints, the road checkpoints near Oka. I understand what you said about security, but in your opinion, are these checkpoints legitimate? Answer. Hélène, from the beginning, when it comes to Indigenous communities, it was important to ensure the relationship with the federal government to ensure that health and safety protocols were in place with resources, funding resources to support this. Obviously, you know the relationship the federal government has with Indigenous communities. The choices being made. I have said this to your colleague. Indigenous communities have been exemplary. We see the proof of this when it comes to the number of infections and the measures that have been taken in these communities to ensure that if there was an outbreak, it was stopped with the aggressive intervention and health measures put in place with, let's be frank, limited resources. They have rich histories and vulnerable individuals living in these communities. The Chiefs Band Councils is concerned in particular with these elders. When you talk about 60 people remaining who speak a language, you have to be careful. They have put in roadblocks, checkpoints at Oka and Ganastake. It's not a barricade. We're not talking about a crisis. We know what it is. And if you follow the news from February, you would see this kind of situation as the economy reopens will perhaps be repeated across the country. But we must remember that with our provincial partners and municipal partners, we're going to ensure there is a dialogue and the full respect for the health of individuals. I have been in contact with the chiefs, Minister Damour, and the latest news that I had was that things were being resolved, but we're not talking about a dispute when it comes to the health and well-being of individuals and a desire to protect those very vulnerable individuals. Far be it from me from judging the way in which these communities choose to implement the health protocols. We must continue the dialogue, of course. And the latest news that I had was that this was a situation that was being resolved.
Oui, je comprends ce que...
Supplementary question. I understand what you're saying, but you're not. Mayor says, for example, I did not go myself to this place, but is it blocking access to the village? Do they have the authority to put up these checkpoints where they're putting them and slow down or prevent circulation or traffic to these areas? Answer. These are checkpoints that were set up, if I understand, with regard to the situation. They were set up with the mayor. This is something that has become gotten a lot of media attention. And there is a judgment being made about the way that people are acting to protect the most vulnerable members of their community. I don't have an opinion on this. Thank you, Minister.
Thank you, merci. Our next question, notre prochaine question nous vient de Dylan Robertson with the Winnipeg Free Press. Please go ahead, à vous la parole.
Hi there. A question for Minister Miller. I'm wondering how the funding is going to be rolled out, if you're going to be dipping into the past application pile under the original $15 million fund. And of that fund, what was the total number of applications and the sum of funds that were requested?
Well, thank you, Dylan, for the question, and I'll elaborate a bit on what I told to Jamie. We did receive, as part of the allocation of the initial $15 million pot, dozens and dozens of applications, a number of them expressing an incredible need to serve the Indigenous population, principally in urban settings, which does form about half of the population of Canada that is Indigenous. We are going to look at the pot of applications that came in. Obviously, the situation has changed. So as we look at how to allocate in an equitable fashion, we'll have to reflect the fact that those applications came in weeks ago and the situation in Canada has changed and there may be different needs in different communities. The most crying example, obviously, is the funding that we provided to La Loche to address a very, very alarming outbreak in that area to the Métis of Saskatchewan, working with Treaty 10 Indigenous groups. And so that is something that we'll have to reevaluate, reassess. We haven't allocated those funds yet. It was just announced this morning, and I can't tell you the total number of applications. I can tell you that the former pot of 50 million was oversubscribed by many factors. I would say 6, 7, 8, but I would have to go back and look and see if that is a number that we would provide to you.
Thank you. Thank you. And Minister Duclos, we have no precise data on the wage subsidy or the CERB. Your departments are publishing overall data, but we have experts who are asking for a breakdown by province, by week, by gender, so that the provinces and some of the ex-office can help shape their responses. I'm just wondering why we don't get more precise data on these programs.
Well, that's an excellent question. First, I would perhaps want to give those numbers that I have in front of me. So for CERB, it's a total of 8.1 million applicants that have received at least one payment, a total of 14.3 million payments made for the Canada Emergency Wage Subsidy. As of recently, a total of 243,000 businesses have been found eligible, and payments for the first period, that is May 15th to April the 12th, these payments cover the wages of 2.1 million workers. Quickly for CEBA, the Canadian Emergency Business Account, the $40,000 emergency loans for small businesses. So a total of 616,000 small businesses have received those emergency loans. But second, I do agree that more disaggregated data would be useful and helpful, especially in the context of journalists like you who have a duty of informing Canadians. And I will talk to my colleagues and see how we can provide those data.
Merci, Monsieur le Ministre. Opérateur, dernière question, s'il vous plaît. Last question.
Thank you. Merci. Our last question est de Lina Dib avec la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour.
Question. My first question is for you, Mr. Miller. I'd like to understand why it took you 2 months before this assistance for Indigenous peoples living in urban areas and off-reserve was announced, given the situation, the growing situation I can see from outside my window, so to speak. And could you provide the answer in both English and French? Thank you, Lina. The underfunding of Indigenous peoples living in urban areas and off-reserve is something that has happened often in the past. Most recently, we have also funding for Métis people. These are relationships that have developed as nation to nation. We have funding, pre-existing funding envelopes of different types. With regard to jurisdiction, it was clear. Financial resources had to be provided to the most vulnerable Indigenous communities, and this would allow them to deal with potential outbreaks of COVID-19 in their communities. And this is what we did. We've known for a long time that Indigenous peoples living in urban areas was present. There are organizations and services with which we didn't have very well-developed relationships. And they're not the same kinds of governance associations as we would have with other groups. They're quite different. So what we wanted to do was to reserve 15 million of the envelope that we had provided for the First Nations, Inuit and Métis peoples to prepare. And I would tell you that it was insufficient. I'm from Montreal, and I see this every day in my own city. Obviously, we knew that people were falling through the cracks, and we reacted quickly to release funding to a number of communities and spoke out about the need for funding. We acted quickly. If we could have done better, well, we'll take a look at that. But these funds will be made available to meet the urgent needs.
What I just said in French, Indigenous Services Canada and the underfunding from a federal perspective, provincial perspective, or a municipal perspective of urban Indigenous groups is something that has been going on for a long time. These are vulnerable groups that exist, and the organizations that serve them serve some of the most vulnerable in society. They have been underfinanced for a long time by every level of government. It's not something that to be particularly proud of, obviously, but we note it. We knew going into this pandemic that we needed to deploy money, resources, physical or otherwise, into communities. The relationship that Indigenous Services Canada has for a long time from a nation-nation perspective deals with governments, entities, in communities, in nations, most often band and council. So that was a funding stream with a different level of maturity and nature than we have and have had historically at Indigenous Services Canada, and indeed from the entirety of government. So we wanted to get that amount out early to those communities. We knew, and that jurisdiction and line of jurisdiction, as I said in French, is quite clear. It is the federal government's duty. It is the Crown obligation to serve those communities. Now, knowing that 50% of the Indigenous communities lives in the urban setting and the jurisdiction of the provinces and municipalities, there is a level of complexity that exists, and there are Indigenous communities and service providers that have fallen through the gap, and they have unique needs that need to be reflected, particularly in a pandemic such as COVID-19. The amounts that we reserved, the $15 million that we reserved, was funded through some of the relationships that we have with the web of friendship centers that Indigenous Services has a relation with. But we knew by opening up an ask process that we would get many more demands than we could fulfill for the $15 million amounts that we had reserved and set aside. That required some work internally and some advocacy to ensure that we had the funds necessary to distribute a much larger amount that we know, and it's in the spirit of not leaving anyone behind. When it comes to our duty towards Indigenous peoples, that is something where the government has stepped up, and these funds are indeed the largest, I believe, allocation of funds to those service providers that I know in any recent memory. So it's something that it is still needed and will serve to protect those that are the most vulnerable. And whether we could have done better is something that we'll have to re-examine at a later date.
Supplementary question. My last question is for you, Mr. Duclos. Earlier we heard Trudeau talking to businesses that are not handling well the wage subsidy or commercial rents. Do you understand why entrepreneurs are not doing what you want them to do? What can you do to fix this situation? Answer. I would say the key word here is uncertainty. We're thinking in particular of the emergency wage subsidy, which was announced a few weeks ago. Companies didn't really understand the situation in which they found themselves. They did not know the nature of the program because it was the first time in the history of the country that the government had moved forward with this kind of initiative. So it took some time for companies to understand how to deal with the new program and make it fit to the circumstances, the complicated circumstances in which many of these companies found themselves now with the announcement of the extension, the 3-month extension, 12 weeks, that goes to the end of August of this Canadian Emergency Wage Subsidy Program. There are many more companies that are beginning to understand how to make this federal aid help them deal with the relaunch. That was the goal from the beginning. It was to ensure that, yes, we would help workers who lost their jobs, and we would maintain, to the extent possible, the jobs, and we would help companies take advantage of this wage subsidy to reopen. So this is somewhat the reasons for this. Last week, with the announcement, we feel that the program will be fully taken up. Thank you, ministers. That ends the press conference.